During today's therapy session, we have a lady named Bernice. Bernice is 48 years old and she had a stroke. She had an embolic stroke that occurred September 30th of 2015. Bernie was out walking her dog when she collapsed to the ground. Unable to move her right side, the neighbors saw it and called 911. When paramedics arrived to the scene, she was unable to speak and did not know what was going on. Once arriving to the hospital, Bernie received a CT scan. They recognized the stroke and was immediately taken to a bigger hospital for better care. Bernie was diagnosed with Broca's aphasia and demonstrates a mild apraxia and right visual neglect. The type of therapy being used in today's session is an expressive anomia therapy. We made Bernie an object box full of everyday essentials, including an orange, a spoon, a cup, a straw, and a phone. We will start by showing Bernie the object and using a few different types of cueing methods to determine if she is able to come up with a word on her own. And notice, the clinician has to show the patient the object on her left side due to her right side visual neglect. Starting off, Bernie is shown in orange, and the clinician will give her different open-ended phrases and Bernie must fill them in.
Are you able to see the object?
Yes.
It's a type of fruit. An apple and orange. Very good.
With the next object, Bernie will be shown a spoon and again be given the open-ended phrase cueing.
Are you able to see the object?
Yes.
A fork and
Orange.
let's try it again. A fork and
Orange.
how about you eat soup with
Or I don't know.
Notice that the patient has persevered on the previous object. Therefore, she will need to be given an additional cue of phonemic cueing.
it's a spoon. You're so close. It's a spoon.
Spoon.
Very good.
For the final object in the box, Bernie will work on a more difficult technique, circumlocution. This method is used when the clinician is not present, so the patient must learn how to find the word on their own in their everyday life.
Can you see the object?
Yes.
Okay, for this, I would like you to tell me exactly what this is. And if you can't figure it out, say whatever comes to your mind first.
You drink?
Correct. What else?
Hot?
It can be hot.
Cold?
Yes. How about can you try writing it down? See if that will help?
Yes.
Very good. What's that say?
Cup.
Very good.
Once Bernie masters therapy using objects, she will move on to photographs, which tend to be harder than the concrete items. Expressive anomic therapy is one of the many therapies used to treat Broca's aphasia. And then that ends today's therapy session.